Terrific.
Yes.
Welcome everyone to our fourth and final session of our Recruitment Boot Camp on mental health staff. And today we'll do kind of a wrap up, but look at onboarding and integrating the mental health care team into the primary care team. And so, as always, the session's being recorded and it'll be available probably in the next day or so on the discussion board. You'll continue to have access to that discussion board, so you can always go back and access the materials. We'll put the slides from this session up there as well. You're always welcome to that resource. And you're always welcome to contact us at the Star Center. If you have any questions or we can help with anything, provide resources, we're always happy to schedule time for one-on-one TA sessions and stuff like that. So please feel free to reach out to any of us. And just I wanted to add in one more thank you to Dr. Ogunyemi for being here for sessions 2 and 3. She provided some really great information and resources, and it's always excellent to have her with us. And then today you have myself and Michelle, and like I said, we're going to cover kind of onboarding and integrating with the larger care team, and then do a little bit of a wrap up. But real quick, we're going to do one little mentee question. I'm curious to know if people know how old the oldest practicing physician in the United States is. And I'll give everyone a second to scan the QR code. And then let me switch screen sharing here. Okay, Michelle, can they say? Excellent. Looks like people can see. All right, we've got a yes for 100, 2 for 96. So the answer choices, in case you need to put it in the chat instead, the answer options are 104, 100, 96, 82, and 67, because what doctor couldn't retire before the age of 70? Like, really? All right, in the chat, we've got a guess of 100. Another guest comes in for 96.
There's another 100 in the chat.
Another 100. All right. Wonderful. Well, the answer is 100. Let's see. Dr. Howard Tucker is currently a practicing neurologist in Ohio. He still trains residents. And let's see, back in 1989, at the age of 73, he took a pause in his medical career and went to law school and earned his JD from Cleveland State University and is barred in the state of Ohio. So he can practice law in Ohio as well. So I guess if you have a career spanning from 1947 to 2022, you can explore some other professional interests in that space as well. So I just thought that was kind of interesting. And if you can retain a provider until they're 100, right on. Let us know. All right, we will jump back to the slides here. If I can find them, where'd they go? Was that correct?
That's the speaker.
The speaker's notes?
Yeah, I'm happy to. I can also share.
Let me just escape out of here. Let's do this. And there we go. That should be correct, right?
Perfect.
Excellent. Okay. So I will turn it over to Michelle.
Yeah, so we're just kind of to wrap up everything. These were the learning objectives. We went through all of the different 4 sessions, so understanding the type of providers, their support staff, special considerations for recruitment and retention. So really that is the work that Dr. Ogunyemi did in her 2 sessions. And then also she talked about how to tailor those job announcements, we talked compensation, a lot of different things. And then today we're going to be really focused in on the onboarding. Oh, and if you could go, yeah, thank you, on the onboarding and integrating mental health care providers into the primary care team. We're also going to talk a little bit when we talk about onboarding with organizational culture. And then what the outcome of our learning collaborative was for all of you to be able to start developing that personalized recruitment plan. So all of the homework that you did, that was getting you started towards that. And obviously with the eye and the focus on mental health providers. And then our hope is once we finish up, you can go and implement these practices in your health center. Next slide, please. Okay, so we're going to split it up a little bit. We're going to talk a little bit onboarding, then about integration, and then we're going to have 2 breakout groups or different activities that we'll have all of you go and discuss. But as we talk about onboarding and really everything that we've gone through throughout this learning collaborative, one of the things that we always want to emphasize, because we understand there's a lot of investment and buy-in that comes into having these recruitment plans, your retention activities, but really at the end of the day, what it's going to cost you in turnover is so much more expensive than being able to invest up front. So one of the things that we have, and actually Alex is working right now on updating this, is our Star Center financial assessment tool, which helps you calculate what are your real costs of losing a provider. And we find this also to be very helpful because a huge part of ensuring that you have that buy-in for recruitment and retention and for your workforce is talking to leadership. And seeing the numbers is incredibly important to them. So bringing that and saying, this is how much turnover is actually costing us versus what we could invest in this. It really is, at the end of the day, in a longer term process, a money saving thing. So we just have here, just a few questions to think about when you're thinking about why retention is so important, why the onboarding process. It's going to be that bridge between recruitment and retention and why you need to really spend time on it. And we hope that this is really also part of your assessment of collecting that data of what you need to really build strong recruitment and retention plans. So next slide, please. Okay, so let's move on to onboarding, but I know I just said a lot with turnover. So I also want to make sure that if anybody has any questions, please feel free to jump in at any time. You can put questions in the chat. I'm more than happy to answer anything as I go through the slides. So when we're looking at onboarding, one really important thing is that onboarding is not orientation. And we'll have a slide coming up that talks a little bit more about that. Onboarding should be a long process. So at minimum, around 6 months, ideally around a year. And I know that seems like a lot. It can seem very overwhelming, but having an onboarding program set can make such a difference. So we're seeing a lot, and maybe all of you or some of you have experienced this, where you go through, you find the right candidate, you get ready to bring them in, and they never show up. We keep hearing this a lot, or they leave right during the orientation process. And that's what we're hoping to really avoid when we're looking at this long-term onboarding process. So it does start with orientation. You still have to have that where, the new employee is going to have HR paperwork, understanding the policies of the health center, all of those different things. But as they go through their first year, and most of us, when we have started any job, it takes us time to really get used to everything, understanding the culture, understanding what we need for our roles. So people who are in that supervisory role, that leadership role, really need to set forth the expectations for their new hires so people don't kind of feel like they're just on their own, not able to know what the next steps are and how they can progress. You also want to integrate someone into your health center, but it's really important, being this is another thing in the other slide, is that integration is not a simulation. You're hiring someone because they were the right candidate, but they're going to shift and change and contribute to the culture that you have. But part of the onboarding process is also introducing this person to your organizational culture. So I think you can see there's a lot of work that needs to be done in that retention piece in order to have a pretty smooth onboarding process. One of the things we also recommend are regular check-ins with the supervisors. So maybe starting off on a weekly basis, tapering off to every 2 weeks, every month, however it is appropriate, and then taking these steps throughout to talk to your new recruit about really how do they feel in the culture, how are they integrating into their work at the health center. And this is especially important for behavioral health because they shouldn't feel like they're kind of an afterthought or this totally separate division that is not really being integrated into the entire workforce. Next slide, please. So as it says here, onboarding is about integrating your workers into your health center. You don't want to assimilate people. If you bring people in and it's sort of like, this is our culture, and if you don't fit this 100%, so that's why we also say using cultural fit is not always the best term to talk about this. People are going to leave really quickly, and they're probably going to leave throughout this process. People want to feel that they have agency, that they are valued in the work that they're doing, and that they're able to, as they go, again, through this onboarding process, really contribute meaningfully to the organization. So how do you prepare this culture for the onboarding process and really across the board for all workforce? But again, this is just as important for behavioral health as it is for any other provider or any other staff in your health center. You want to build that strong workplace culture. So you want to focus on the physical, the mental well-being. What are the financial considerations, career health for people? Do you have good communication in place? So all of these things you really want to think about and implement them into your onboarding process and talk to people. Let the new hire know, like, these are our well-being activities that we have. These are the financial health activities that we may offer. This is the way that we do communication here, whatever it may be, but it's important that they see who you are as a health center and why they're working there during that first year. And of course, oh, sorry, I was going to say next slide. I tried to click on the next slide on my computer. And then when we look at onboarding, like in a wide sort of perspective, again, integrating the employee into the organization, it also increases productivity. People, again, just feel like they have a purpose, they know what their role is, they know what they're supposed to do, and they have the support that they need. And again, going back to behavioral health, that is so incredibly important that people in behavioral health don't feel like they're just being pushed to the side, because unfortunately that has happened to a lot of them in this role. So you really, again, want to integrate the employee into the whole organization. It's going to set those expectations again, which helps with productivity. And finally, as we said, reducing turnover, because turnover is very expensive. Next slide. So as we wrap up this onboarding piece, really, again, as you're onboarding someone, when you have those meetings with the new employee, you already want to start discussing like development opportunities, what are career paths that they may have, what is the health center really planning for them, so that it doesn't feel like they're coming in just to do a job, but they really are building a career at their place of employment. You want to encourage them to explore new opportunities, again, that professional growth, and have these conversations with them. Do stay interviews during the onboarding process. There's just a lot of things you can do so people feel like, okay, they hired me. I'm more than just another worker here. They really value what I'm bringing. And then finally, as it says here, long after the main onboarding phase, you want to continue to check in with people, see about those development plans. How are they doing? Why are they staying at the health center? And what could make that better? And again, you want to really have that eye on, these individuals are coming in, they're behavioral health providers. What are their specific needs, which is really what we talked about in some of the previous sessions, and how you can develop that for them. Oh, next slide. So I'm going to pass it back to Alex, but if any of you have any questions on onboarding, we're more than happy to answer that.
Yeah, thank you, Michelle. And yeah, just to reiterate, the onboarding process is that kind of like overall thing, and that includes bringing people in and letting them add to the workplace culture and get to understand it and see where they can move within the organization. And I think that a big part of that, and part of what, at least for me, I've found a lot of job satisfaction comes from, is knowing that even if it's something outside of my specific realm where I can help someone, is that I can connect them with other resources that would be helpful. So that would be within the health center and even within the larger community. And
probably, oh, sorry, Alex, I should have probably also said Alex is still technically in the onboarding phase at his role here at ACU. So I think he can also have some good insight on, what works, what may not work, those type of things of what a new employee may want in the onboarding process. So you can ask him questions.
Yeah, absolutely. And because ACU does practice what they preach. And so Michelle and I had check-ins, initially weekly, and then we've slowly spaced them out more and more. And, she kind of makes sure that it's not a burden to me, like, oh, we have to have this meeting and it's too much. It's like, this is a check-in to help you. And then also having conversations around, where do you want your career to go? Like, what are your interests versus what's kind of available within the organization? Let's find that overlap, and having those conversations and letting people know from really early on that they have a place to go in advance. I think is something really important to helping people find that drive and that satisfaction, rather than just getting stuck in where they kind of feel like they're in a rut and not going anywhere. Whether that is professional development and just becoming better at what you do, or whether that is moving on to other positions or other opportunities. And then also getting to know, again, the larger health center, because I think that all of the teams within the health center should be communicating with each other. And sorry, this is evidence that I am not a graphic designer, because there's a lot going on here. It's very messy, but bear with me. Basically, the idea that your mental health department should obviously be in close contact with the physical, dental, and vision health teams as well, whichever ones you have at your health centers. And that is so that not just your mental health providers knowing if someone comes in and expresses an issue where they're like, oh, that's a physical health realm, I need to connect them to that care, but also the other way around. So that even if someone goes in for dental or vision care and the provider says like, oh, there's some other stuff going on that this person would really benefit from, a social worker, a therapist, some other social services, and then obviously community resources as well, because health centers do so much and they just can't do everything. And so people might benefit from, sometimes there are places they can go for financial or career counseling, nonprofits that do that and things like that. They might need specialized care. Sometimes people might benefit from being connected with a faith-based organization of some kind, home health options, all kinds of things. So just knowing what those resources are in the community and letting providers know about them, I think is really important. And then integrating all of that into the care that the health center provides to be really holistic. Not just helps, obviously, the clients that you're serving, but helps providers feel that even if something is outside of their realm of expertise, they can still help that person. And that's really important to job satisfaction, because it feels really bad if someone comes to you with a problem and you can't help solve that. And real quick, we have something in the chat. Oh yeah, Michelle was mentioning that there are dentists that do depression screenings and things, because someone might receive dental care more frequently than that might be their only contact with any kind of care provider, and so that might be a chance to connect someone with care that otherwise wouldn't come in. Eventually, if you have like tooth pain, can become so overwhelming that like even if you're someone who would never go seek care, eventually you have to go see someone, and that might be an opportunity to bridge someone into other resources that they really need. And then we're going to now break out into some discussion groups. I know we're moving through lots of pieces today, but I think now is kind of our opportunity to start reflecting back on this whole process of everything from the recruitment phase to the interviews. And now we've talked a little bit about onboarding and how that longer term retention is going to look. And so we'll let you break out into some groups and, you know, maybe reflect on what is the onboarding process. Look at your organization. Is there anything else you could be doing to make it more than just orientation? And then does any of the onboarding process at your organization expand beyond just the department that the person's going to be in or the team they're working with? Does it include kind of that larger network within the health center or even within the community? And, you know, if not, that's okay. That's, I think, pretty standard. And so how could you start to expand that onboarding process to make sure people have all of these connections that they need? Okay, welcome back. Looks like we've got everyone. So hopefully that was kind of a good discussion, got you thinking about the onboarding process and how much the different departments in your health centers work together. If anyone wants to, we'll kind of go through the groups, and if anyone from a group wants to share a point that they discussed, you'll be welcome to. You certainly don't have to, though. We'll start with group 1. Or if people remember which breakout room they were in. Otherwise, if you'd like, feel free to just unmute and share.
And then we can also call on people. So, now, although Alex would say you didn't have to share.
Yeah,
so
yeah. I'm not gonna make people share.
I was like, let's just call on people.
Yeah, especially if it's potentially self-critical. I don't want anyone to have to do that. But
I can share. So in my group, we talked about just our, you know, we obviously introduced ourselves, and we all are kind of scattered in different parts of the country, which actually makes a big difference. You know, somebody talked about stigma, that some people in that they don't ask for help. And they also talked about, like, you know, what the politics are. So I think, like, I'm from Michigan. So in Michigan, you know, we have a diverse population, and political wise, you know, like in Michigan, we've had social workers who have been governors, and I think it's made quite a bit difference of helping those that are, you know, with social determinants of health and stuff. So that was one point that I thought was really interesting. Another point that was made was just looking like what is like the private practitioner groups doing, and how many of them are out there. I know, like, where I live, there's a lot of private practice, more so than, you know, working in your centers or for like other places like community mental health, just because of the flexibility of it. You know, I know a lot of people who work private practice work like 4 days a week instead of 5. So it was just a couple thoughts we had talked about.
No, I think that's an excellent point. Especially, I like the idea, like, yeah, you might, like any health center could get someone coming from out of state or just a different area, and kind of part of that onboarding might be letting them know, like, here's what the community looks like, and kind of how people are going to think about different issues potentially. And
yeah, I think it's like, you know, like culturally what's happening in your area with just like behavioral health in general is a good point. And then just like for onboarding, for me, it's really hard of just being so busy and wearing so many different hats that sometimes I feel like the people who we do hire somewhat get lost in the shuffle. So
one of the things I would suggest, and this is why we're like, put together your plan, because at least you can have something in writing, but that direct supervisor meetings that can be had of really fitting into part of that supervisor's role can be really, really effective, because then they're able to gather a lot of information, bring it back up to leadership, those type of things, but really making it part of the job role of the supervisor can hopefully, and I know I'm saying this and everybody is so busy, but free up some time in the sense of this is part of the job. They already have these standing meetings, the supervisor going into it with questions very specific, talking to them about career development, professional opportunities, all of that could be very effective in an onboarding process, where maybe if it's not as formalized in the whole health center, being able to have that can be really helpful. And I also agree about the community. So in DC, I believe they're planning now to give students free MSW degrees, because there's so few behavioral health providers to incentivize more people to go into that. So the Masters of Social Work. So also understanding what's going on in your community is super important.
Yeah, excellent. Thank you for sharing. Let's see, Sean unmuted.
Yeah, I did. So we were discussing the onboarding process, and looking across this. I mean, we had somebody from Sacramento, Cincinnati, and then me in the UP of Michigan. Very city orientated and rural orientated. We're all having the same issues. One of the good things is it sounds like everyone had onboarding process with the integrated model, and also the check-ins with the director, and weekly meetings. I mean, we do MAT, addiction medicine also, which involves counseling, having them get together and have a sounding board to make a community together, and making it their practice, to give them a little bit more ownership, I think is better than working for the man type organization. And the one thing that we kind of not got stuck on is, like you were saying, with the individual programs, the funding for behavioral health has increased dramatically through COVID and now post-COVID, but the education system is lagging behind, with the amount of providers available. And then we're limited also with who we can take, because for billing purposes, LMSWs for behavioral health is the best, but a lot of these people are in private practice, like where they're at, they're not moving. So we have to really concentrate on the limited license coming out with their first job after MSW, to work within the parameters that we can, with the payers and everything else, and having a plan as part of their onboarding. How are the patients, that you can't bill for, let's get them to the LMSW, and just having that communication within the group, I guess, were some key things. And then also, just recruiting, we kind of went on a little tangent on, hey, what are you using? Have you used individual groups? And then one of the things that I'm starting to do is, with our current workforce that we have in our clinic, utilizing them. Hey, do you have a friend that's interested? And I missed the last meeting, so if you guys talked about the marketing stuff, but yeah, I think it was a good refresher for us to kind of get us motivated to, it's like, oh yeah, let's try this. So, but when it came to onboarding, it is essential, so that we can move forward and keep these people. And I think the key thing is keep them happy, not getting them overworked, and having somebody else. I mean, I always, probably not right thing to say, but most of the people that go into social work have their own issues, and having a backup program for them to be able to voice internally, to get their own help and learn additionally. So
I just, to that point, I remember when I was in social work school, one of the first things they told us was, make sure you have a therapist for you if you're going into this field, and that you have a really, really good therapist to work with. So 100% very true. And I think, everybody, but when you're in certain fields, you know, there's things that attract you to those fields. One of the things I did want to also say, because you brought up the issue with the limited licensing and the difficulty getting the clinically licensed providers. So I know from my friends who are clinical providers that are social workers, most of them now are looking for part-time opportunities so they can kind of split their time between working more with underserved populations and then having a private practice where a lot of that income supplement comes from. So if that is something that your health center can offer, of the flexibility of being able to do part-time, allowing people to also keep their private practice, that can be something that people who are looking for jobs may really find enticing. But I know that that can also be a complicated thing, but if you're able to offer it, highly recommend that.
And then to go off of that, one of the things that I mean, because they started paying for telemedicine,
Yes.
that was a huge
Mhm.
thing. And then also offering flexibility in hours, you know, like you said,
Yes.
a lot of them will have their part-time practice, but
Mhm.
you know, would really like to, you know, do the mission-driven work.
Yes.
You know, and having that appointments till 7 o'clock at night, you know, having that flexibility, but also having the internal support for them, you know, for people to, you know, to be logging in and to check them in, you know, is
Exactly.
key. But I think in the long run, this is, I mean, we have to, I don't want to say McDonald's type, you know, get it the way you want, you know,
Yeah.
but to retain these people and
Yeah.
to get these people. So
Exactly. And it's, you know, and I think it just goes back to that first slide that at the end of the day, I know these are things that can be costly, but what's going to cost you with the turnover and not having someone there and then bringing on people consistently to onboard them, orient them, all of that, way more expensive.
Excellent. Well, I think then we will jump to our next and final breakout session. So this one will be a little bit shorter. I basically just wanted in your breakout groups, just go around and kind of share like what's one next step you're going to take. Like one thing you've learned from the whole recruitment boot camp that you're going to like take with you and actually do. And it could be something really big, or it could be, you know, something really small where you're like, nope, just like tomorrow or the beginning of next week, this is an action that I'm taking.
Welcome back, everyone. So we do have 5 minutes left. So what we were thinking was, I don't know if just one person wants to share out on what would be their first step. And if other people want to put what they talked about in the chat, that would be great. We just want to make sure to leave enough time at the end for a few other things. So would anybody like to share really quickly? Or at least I hope there is some first step you are taking.
Yes.
Thank you, Cynthia.
Everybody's quiet. Come on.
I know.
I've been listening to everybody all day. So somebody said, like my Ingrid said, updating the website of like what we have to offer, not just like offering the jobs,
Yes.
but really, you know, putting it out there. What she really wants to update their website into that information. So I thought that was pretty neat because like that's stuff that we look for, right? Like why do I want to move to this position? What do they have to offer me? And then instead of like getting there and be like, oh, well, that was a waste of my time.
Exactly. And you're selling your whole brand, you know, you're selling the entire health center to the people who are applying. So I think that is such an excellent thing to work on. And then Jenna, I see you have your hand raised.
So for us, there were a lot of things that we were already doing, and but we were not publishing our salary ranges and our job ads.
Right.
And so I talked to HR about it, and they have said, yeah, that's an issue. We were losing out to competitors within the county that do publish their job ads for the organization, and they actually this week published it. We had to do it internally first so that everybody saw what the salary ranges were for tiers. They published it internally, and now we're going to publish it in our job ads.
That's amazing. That level of transparency to not just start putting it in the ads, but first with your employees. I think that is such a pillar of building that great organizational culture. So congratulations on that. That's wonderful.
Thank you.
And then, yeah, if anybody has anything else, feel free to put it in the chat and I can, Alex can wrap us up.
So just wanted to leave you with some resources. And again, the PDF of the slideshow, we'll post that up as soon as this ends, and that will have all of these are links. And so you'll be able to click on any of them. But we have plenty of resources out there, including some e-learning courses for people like those, or if you want to have, you know, someone who's maybe newer in a position take those to kind of get a feel for some of these topics. And then we have the Star Center compensation bundle, which has lots of information on the compensation side of things. So really great resources. Obviously, you're welcome to reach out to myself or Michelle. And Michelle also has a colleague who is able to post to the University of Central Florida job site, and they have people, as we talked about before, all over the country who are looking for clinical hours to work towards certification or also looking for jobs. And then the final thing that we want to do is please ask, or I'm sorry, is ask you to please fill out the assessment. Mariah has just posted the assessment link in the chat. It's only a couple questions, but it is really, really helpful for us. And, you know, also we actually want to hear what people thought and how we can make things better. And so the other post-session assessment is just this little 5-question one that popped up on Zoom. So please, if you can fill that out before you leave us today, that would be fantastic. And then as always, tons of resources at the Star Center, including we have a podcast who our colleague Helen has done a bunch of the interviews for the 4th season of that, and they're really terrific. They focus a lot on wellness and how you can build wellness into your workplace culture. So I really recommend that. They're really excellent episodes. And yeah, reach out to us for any way we can help. It's been great having everyone here for all of these sessions for the past 2 months at this point. So thank you everyone for joining, and I hope it was useful.
Yeah, thank you so much. We're here to help at any time, so feel free to reach out to us. You still will have access to the recordings, to the discussion board. I know I owe people some responses, so I will make sure to do that. And there is one quick thing I want to point out. Alex, if you could just go to the resources, you don't have to, but our comprehensive workforce plan template has been completely updated. So it has all different tables, everything that you need to put forth an entire comprehensive workforce plan, even beyond behavioral health providers, or you can just use it for the behavioral health providers. But you have everything you need on there. And yeah, and I thank you for the thank yous in the chat. Yeah, and whenever you are done with the post-assessment evaluation, please feel free to head out. And I hope everyone has a really, really wonderful afternoon. Bye, Ingrid. Thank you. Yeah, y'all were a great cohort.